Hello and welcome back to a very important session of 3-day APAC HealthTech Innovation Conclave. Today is the first day, and this is one of the important sessions on building digital infrastructure for a better and connected healthcare system. And we have been joined by the eminent leaders from the hospital ecosystem, who are the technological leaders in their own respect, as well as industry leaders have joined us. Let me first introduce to all of you Ms. Vilu Williams, CIO and Head Digital Transformation, Sir, HN Reliance Foundation Hospital Research Center. We welcome Ms. Vilu. Thanks for joining us.
Thank you. It's my pleasure.
We're also joined by Sri JP Dwivedi, CIO, Rajiv Gandhi Cancer Institute. Thank you so much, Mr. Dwivedi, for joining us.
Thank you.
We're also joined by Nilesh Shinde, CTO, Jupiter Hospital. We welcome Mr. Nilesh. Thanks for joining us.
Thank you.
We're also joined by Mr. Piyush Arya, Chief Growth Officer, Ognito.
Thank you, Shavik. Good afternoon, and look forward to having a great discussion.
Yeah, same here. We're also joined by Mr. Shashank Saini, Head of Digital Health, Ujala Cygnus Healthcare. We welcome Mr. Saini.
Thank you, Shavik. Thank you, everyone, for having me.
So before we start the session, let me give an overview of what has been done throughout the day in this 3-day APAC HealthTech Innovation Conclave. The inaugural session was how technology is playing a vital role in improving the public health landscape, especially beyond pandemic, the way forward. In that, we are lucky to have the presence of Sri T.S. Singh, the Honorable Minister of Health and Education, Government of Chhattisgarh. He attended the conference as a chief guest. We were also joined by Professor Dr. Nitin M. Nagarkar, Director, AIMS, Raipur, Dr. Neeta Verma, DG NIC, Dr. Ratan Kelkar, Mission Director, National Health Mission, Government of Kerala, Kamal Arora, Public Sector Head, Dell Technologies, Professor Sarman Singh, Director and CEO, AIMS Bhopal, and also we were joined by, in that session, by Dr. D.K. Singh, Director, AIMS Bathinda, Prabjot Singh, Mission Director, NHM, Government of Haryana, Mr. B. Sundar, Special Secretary, IT, Government of Andhra Pradesh, and Dr. D.K. Sharma, Medical Superintendent, AIMS Delhi. They were all part of the inaugural session. Then we had a presentation by Mr. Venkat Sitaraman from Dell Technologies. It was followed by a panel discussion on virtual care deployment for accelerating today's healthcare environment, in which we saw the presence of speakers from Akash Healthcare, CK Birla Hospital, KIM's Hospital, Excel Hospital, also from Doxiva and Digital Health. It was followed by a technology presentation by Mr. Rustam Lawyer, co-founder and CEO, Ognito. And then we had a session on reimagining patient care delivery and workflows in New World Order, in which saw the presence of Dr. Alok Roy from Medical Super Specialty Hospital, Dr. Hari Prasad from Apollo Hospitals, Mr. Rupak Borua, Group CEO, MRI Hospitals, Dr. Suchin Bajaj, Founder Director, Ujala Cygnus Healthcare Services, and Colonel Dr. Sunil Kumar Rao, CEO, GCS Medical College Hospital Research Center. Why I just talked about all these sessions, because this will give you an idea to all our speakers, to all the esteemed delegates, that we have tried to touch on various aspects of digital health tech innovation. Today also, tomorrow, and day after, and we're trying to bring the best of the minds together to discuss and deliberate upon various aspects of creating that digital healthcare ecosystem for a better future, especially in the New World Order. With this, let me ask the first question for this session. This session is all about building digital infrastructure for a better and connected healthcare system. Let me ask the first question to Ms. Vilu Williams, CIO and Head Digital Transformation, Sir, HN Reliance Foundation Hospital Research Center. Ma'am, what do you mean when we say about that increasing the outcome by leveraging digital innovation? How can we increase outcome of physicians, of workforce by leveraging digital innovation more and more? Your thoughts on that?
So thank you. See, the thing is that when we are talking about digitization in a hospital or in a healthcare ecosystem, we have a lot of avenues from where data is collected. We have our regular administrative data, we have a lot of clinical data of patients, and these things are already digitized since years. So it's nothing new to have a fully automated or a digitized hospital. So how do we proceed from here and really take the hospital digitization to a new level. That is where we look at how to build clinical outcomes, more digitally. Everybody, of course, all patients like to, doctors to see them, talk to them personally, and so on. But nowadays, people are looking at internet so much. They, do their homework much before they even come to see a doctor. So when we look at these kind of things that are happening, we also want to know, if I put together all the clinical data, let's say, which I've collected in the hospital over 10 years, 15 years, 20 years, all right, and then we do an analytics, which is everybody's talking about AI today. So when we talk about artificial intelligence, or when we talk about, even simple things like, let's say, machine learning, when we put together all the algorithms of the various clinical learnings which doctors have already collected or through their expertise, and if we can digitize all that with the data that we have collected, we can get fantastic outcomes which will help future doctors to analyze better, to treat better, and to give faster results to patients vis-a-vis their treatment, or vis-a-vis their getting better overall. Plus, it is also that when we are talking about hospitals, we are not only about sick patients, we are also about wellness. So when we talk about outcomes, we also must consider that people today come to the hospitals for wellness also. And a lot of hospitals are driving towards that. So when we have so much of data, we can predict and we can expect people not to fall sick, or at least know well in advance what they are heading towards. These are the kind of outcomes that we look forward in a hospital to bring in from a digital perspective for the doctors and the clinicians. I hope I have succeeded in answering your question to that extent.
Yeah, absolutely, absolutely. I'll come back to you, Ms. Vilu. Can we have a perspective from Mr. JP Dwivedi? Mr. Dwivedi, your take on this?
Sure. So what outcomes are we expecting? I would categorize all the outcomes broadly into 4 verticals. First and foremost, patient comes because he or she is suffering from a disease or pain. So take care of the disease, provide the healthcare delivery. First outcome, get me rid of the problem. Second outcome, as I have walked in, let me walk out. Do not make an error, either surgical site error or medication error or hospital-acquired infection. Very important second desired outcome. Third outcome, try to minimize my cost, make the treatment affordable. And fourth outcome, I don't expect you to treat me like a king, but at least minimize my discomfort while I'm there in your care. So these 4 are the broad outcome areas. And technology fortunately covers all the 4 areas and can help significantly and is helping significantly. So let us start with the clinical outcome. In clinical outcome, typically what all we do, there is a diagnosis, there is a prescription, and then there are certain procedures that we undertake, right? So in diagnosis, technology is helping accurate diagnosis, cost-effective diagnosis. Look at the filmless radiology. Look at the artificial intelligence that is coming inside radiology, X-rays, ultrasound, CT, all procedures. And those images analyzed and coming, spotting the dots and the lesions which are hardly visible to the naked eye. So in diagnostic area, technology is helping tremendously. Similarly, in the procedure area, see, robotic surgeries are going on. Now there are a lot of active interventions which are happening. Like TACE is, administering chemotherapy at the point of the tumor. Radio frequency ablation. All these very precise procedures, technology-enabled, technology-driven, helping giving accurate dose of the medicine at the site of the disease, saving the patient's side effects and problems. Third, cost reduction. So if we can minimize, using the operational excellence, minimize patient stay, optimize procedures, cost will automatically come back. Administering only as many tests, examinations as required will help in reducing the cost. And finally, patient experience. So when we automate workflows, there is no need to write myriad of papers. Instructions are flowing online automatically from one station to other, and patient is not really running pillar to post, taken care of by technology-driven online procedures. So that is broadly how technology is helping doctors, hospital, patients, everyone in the ecosystem. Very simple, very down to earth. You go deeper, and technology is playing deeper and deeper, more and more advanced roles, but covering all these four broad pillars of the outcomes.
Right. It was short and crisp, I must say, Mr. Dwivedi. I'll come back to you. Can you have a perspective from Mr. Nilesh Shinde, CTO, Jupiter Hospital? Your take on this?
So I consider that digitization almost 5 to 6 years back, we were thinking about that digitization is paperless environment. But nowadays, in last 6, 7 years, the way it has been evolved, it is not only for clinical but non-clinical people also. It is really useful. Now I will give you an example. If you say that there is a lot of automation has happened in lab equipments. So because that, what happens that there is a load on the technician of the pathology has reduced a lot, and they can give a better result. Outcome, clinical outcome of these results also much on the higher side. The reason for that, now automatic quality assurance can happen, automatic maintenance can happen. You can do immunology and biochemistry on one machine also. Now, along with that, if you ask me for the maintenance point of view, uh, now, what is important is that in any of the hospital is that energy conservation. That is one of the part which is very, very important. With now specialized IoT sensor, we not only can able to control the light and power, but also we can able to control the HVAC part of that. We can also do the asset trackers also from there with the help of this specialized IoT sensor. So if we utilize those sensor, definitely it is much better than BMS also, because those are advanced sensor, and we can able to make sure that the load on the maintenance staff reduces, and they can give better efficiency, and that really helps, because if you can able to maintain proper OT, ICU temperature and humidity, it definitely gives a better infection control on during the hospital processes. Now, along with that, if I consider that nowadays, if you know that there are a lot of ambulances which are there, which while when we call comes from the patient to the any ER, so whenever we send any ambulance to that per patient house, now all these ambulance are like, I can say that it is enabled in such a way that patient relative can get the location of ambulance also when it's going to reach to the at their home or their place. So when we lift the patient from their home and put it there in ambulance, the ambulance is always connected to the ER department. What is the advantage that by that time patient comes to the inside the hospital, all his data, all the clinical parameters are known to the hospital ER department head, CMO. And what is happening because that he can able to plan what need to be done very easily. And whenever patient comes from ambulance to the casualty, the way the data has been transferred easily, it always gives an alert to all the departments, right from its, if it is sudden ICU requirement is there or operation theater requirement there, all alert goes along with the admission, everything goes very smoothly. So it is always a pleasure to the patient relative, because they are under tremendous pressure when they want to come to the any hospital. Now, along with that, nowadays, if you see that there is always a boom for sensor or wearable, what we can use, where we can get the information which has been, or maybe we can keep it there or we can wear it, and from there we get all vital parameters to the command center. And this is what the need of the hour, that everyone wants to understand what is going to happen for himself from the vital parameters. So that is something is a digital automation definitely can give us, and it is a really good increasing outcome for the digital innovation. Along with that, if you see that nowadays with IOMT, you can able to connect the ICU as well as OT integration. So because that what happens that anesthesia charting, ICU parameter, vital parameters, it get captured, and because of that, clinical decision makes very easy for the clinician also. And at the same time, there is a very less load on the nursing staff because they can concentrate more on the patient rather than doing all this chart work, because that is a tedious job for them also. Along with that, nowadays, because of home health, we can able to track the vital parameters, the respiratory parameter, the prenatal parameter, and we can able to track those parameters and that get connected to the main clinical center, so that patient also knows that where he is going ahead and what are these action plan which is known to be patient, it is known to him. So earlier, like the consultant used to tell us that this has to be done, but now patient also take care of himself, and because of that, he is aware about that what is his condition with the vital parameters. So all these things are really giving an advantage in case of digital innovation, what is happening, and we are really getting good outcome out of this. And I'm sure with National Digital Health Mission and with the use of digital innovation, the time will come, the gap between the rural and urban area across India, most of the hospitals will get reduced. They will get a better service with the virtual critical care centers. They can able to access this their parameters in the through the virtual care center, and I'm sure that from years to come, the way in the latest financial budget also, it has been considered that a lot of primary and secondary and tertiary care centers will be open up across India, and which will definitely improve our outcome through the digital innovation. Thank you.
Interesting take by Mr. Nilesh Shinde. I'll come back to you. Piyush Arya, Chief Growth Officer, Agnito. Your take on this, Piyush, when we talk about increasing outcome by leveraging digital innovation more and more. Your thoughts on that?
Well, I mean, thanks for having me here, and good afternoon, everyone. I think if I were to talk about digital infrastructure, let me try and break it down into two parts. On one paradigm, we're talking about, I think Nilesh just mentioned a point about rural versus urban. Let me also just bring in, the public versus the private, government hospitals versus private hospitals. I think the one thing that's consistent across both is, other than, the paying capacity and the payer structures, wherever you go in a hospital, you always see patients waiting for doctors, right? Now, there's been a lot of talk about patient centricity, about how, a lot of these innovations around, driving patient experience are really coming up. But I think if I were to, just sit and pause to say, predominantly in an ambulatory OPD setup or in an inpatient setup, if I were to talk about three core stakeholders, definitely the clinicians or the physicians, nurses, doctors, techs, and everyone else. Patients on the other side, and then there is the whole hospital administration that makes it happen for the healthcare provision. Now, across all of these three different stakeholders, in my humble opinion, physicians are currently, the choke or the in operations management, they say, that's the stranglehold. And therefore, if we can enable physicians to do their job faster, better, cheaper, I think that's where, true innovation can actually, just drive a paradigm shift in terms of, eventually patient experience as a lag indicator. Now, I think if I were to hone in now on saying, how do we help physicians' lives get better? I think there are about 2 or 3 things we could look at talking about. How do you drive efficiencies in the way they currently work? How do you drive better productivity for them? How do you drive, from a hospital administration aspect, better data analytics? How do you drive, data capture through all of these, digital, systems to say, I'm capturing every encounter a patient has with a health system. And therefore, I know there's a session coming up tomorrow morning on interoperability on how you really connect all that data across multiple disparate systems. But, once you have all of this baseline digital infrastructure set up, that entire paradigm is, starts with saying, do hospitals, especially on the government side and deep, remote centers, do they have stable internet? Then coming to the next rung to say, do they have a running HIS or other EMR systems, LIS, risk packs, you name the systems. The third thing then that comes up is, with internet and the systems, is data actually being, pushed into the system? What's the story about, adoption and data capture? Once you've navigated through that, that's when you start developing that longitudinal patient care record. How does that happen in terms of, driving, better acute care? I think JP Dwivedi earlier mentioned about saying, I'm not saying, treat me like a king, but at least do not push discomfort at me. With everything that's happening on the NDHM and, getting into the HIE space, we will talk about that tomorrow. But as a patient, what is it really that difficult for me to say if I'm walking into a particular hospital, for an outpatient episode with a neurologist, and let's say I've had a surgery 3 months ago with the same hospital in a different department, is it really that difficult to connect all that data from outpatient to inpatient? And I think those are simple things that patients will probably start expecting and demanding as we transcend into the future of healthcare innovation. But I think now, when we talk about improved outcomes, when we talk about better patient care, a simple thing that I would really crave for is when I'm showing up for an outpatient, setting, I wish my doctor wouldn't keep me waiting for about 20, 25 minutes, right? Reduce my wait times. The second thing is, let's say when I've gone through some kind of a scan or radiology or a pathology blood draw or whatever it is, get my reports back to me faster, right? As a hospital administrator or a business leader, I would probably say, can I get more patients in through the door? Can I give them better patient care? Can I reduce the stress and burden on my physicians to say, if, for instance, if they're currently spending about 2 or 3 hours in front of laptops just documenting whatever they're, really administering from a provision aspect, can I reduce their time? Can I make more time available for physicians to, instead of, finishing off an OPD consult in 5 or 7 minutes, can I give patients another 2 or 3 minutes? Can I make it a little more humane in that encounter, whether it's OPD or IPD? I think those are some of the key things as it will probably boil down. And of course, you probably would have heard on Rustam's, conversation earlier as well about, how you can improve efficiency, you can drive all this productivity, and at the same time improve, the bottom line, depending on how you're structured as well. And at Ognito, I think that's one of the many things that we're looking at driving in terms of, saying, when you're talking about speed, when you're talking about accuracy, when you're talking about agility, when you're talking about impact, how do you really get through all of your clinical documentation, whether it's, reporting for, a lab or a radiology test, whether you're, literally, getting discharge summaries done, whether it is, there's tons of, documentation for JC accreditation or any other accreditation, and you probably, put like head counts and typists, around the hospital, just busy clacking away at your keyboard and, typing a ton of documentation. I think the true innovation, at least in my humble experience, across those 3 stakeholder groups, would be, taking that pain away and really just enabling voice as the new frontier. Because I think what I will probably, leave as last thoughts would be, while yes, I'm not discounting the fact that, we've got these smart ambulances and, we know exactly where a particular ambulance is at what point in time. But 20 years ago, if somebody had said, a car will drive by itself, people would have said this was sci-fi. We have self-driving cars running around the world. It's not too far when India will have self-driving cars as well. Of course, lane discipline will probably, lead to a lot of that success of that technology. But I think, as information technology and ICT leaders, we really need to push the boundaries and envelopes in terms of, really thinking and defining, what the future frontiers would be. And I think in the tremendous work that our product teams are busy doing on the voice frontier, we truly believe, data capture, if we can solve for that one, key thing, it just enables, so many, challenges, resolving rather, across, just getting data into your EMR, into your HIS, just getting, faster, better, cheaper reports and documentation done. And that's one area that, we're really humble and, proud to be part of. So thank you.
So as Piyush was saying that, if I can take the crux of what Piyush has said, I'll come back to him as well. Maybe taking away the pain by using innovation and technology. And that can be a interesting aspect. And I think other speakers have also touched on that in a different way. But thank you so much, Piyush. I'll come back to you. Let me have a perspective from Ujala Signals Healthcare, Mr. Shashank Saini, Head of Digital Health. Shashank, your take on this?
Hi, I think all have mentioned and touched the basic points, right? Piyush have touched on the very basic efficiencies that we always think about. That should be the baseline, the basics, having the efficiency improved or the yield for the doctors or the staff, right? The rest of the, panelists talk about the future AI, ML, how the internet or the technology will work. But, being on the other side, so I have seen the both sides of healthcare, selling technology now, buying technology or building technology, right? Still, I believe, and the biggest problem that I see, right, when we talk about doctors or the consumers or the patient, is the acceptance, right? How do we can build amazing products, we can build voice, we can build smart ambulance, we can do the Uberization of everything, right? Right, but the moment, and the Indian problem, right? We want that personal touch, right? That's one thing which still is the biggest challenge, because building up technology, I think, agree a day or a year will be there when things, and this same language of mine will be changed and will be proven wrong. But today, when we talk about our next 2 years, 3 years, we still know, right? We have a habit of forced learning. That's how the Indian blood behaves, and that's what pandemic taught us. Having a dependency, and good to have a telemedicine solution or a health tech improvisation. Now, coming on to the hospital segment, when we talk about like what we should do in terms of development of technology, I think let's keep it very, very basic, as Piyush said, right? Because that's something which really helps you to improvise your entire setup, keep your timelines or your thoughts very precisely, what you want to do in terms of infusing technology. Because when we talk about technology, is huge, right? The developers or the product guys, those who are building up and learning from Europe and US market and getting technology built up in India, every day there's a new startup in the health tech space giving us something new value proposition to you, right? Using technology, I think I believe, being an not a pure IT guy, but yes, understanding technology as a layman. Let's use technology to optimize and reposition your core business, right? We all are, barring Piyush, I believe we all are into the hospital business. I think let's get the basics first, which is your core business. How do we infuse technology, improvise the entire experience of a patient as well as doctor or the staff, right? And now think, what is the way forward? We are talking about IOMT, we're talking about your AI, machine learning, and everything. That's good to have. So I keep it very simple. 2 buckets: what my current business requirement is, what is the future way I have to move in on, right? And we all understand that the digital capabilities, allows you to provide provide care on your patient terms, improve access, help patients stay well, offer continuous patient engagement. They create a better experience, increase efficiencies, staff productivities. There are a number of things that we can talk about, right? So, as everyone has said, I think the future of technology, yes, welcome it up, right? What the current is, what you need it, data. I was reading somewhere that if data is the oil, then the healthcare is the rocket, right? So that's the power that in healthcare data, if you are capturing each stage, right, as everyone mentioned, right? I think that's the game changer. I think invest in the technology going forward, which is your IOMT or IoT, right? Proactively address health problems, removes the barriers to health, right? There should be transparent, simple solutions at a consumer point of view, which is your front end, and a strong, solid, robust, technology support for your back end. I think that sums up my thoughts on this.
Interesting thoughts from Shashank. If I may come back to Vilu, my second question to you and to other panelists will be that when we actually talk about tech-led hospital automation, how does it help in enhancing the cost-effective efficiency? Your thoughts on that?
Cost for whom? Cost for the hospital or cost for the patient?
I think cost for the hospital, obviously, and because that will again pass on to the patient's later stage.
Yeah, so that's really a good question, because everyone in the hospital today are always driving at how to save costs, because it is becoming very expensive day by day for the patients, since they are the ones who are going to pay for all the technology enhancements that we do. No, I've said this before also in some of the articles or the others, that when we talk about continuously enhancing technology, who are we going to pass that cost to? It is finally the patient who's going to bear it. And does the patient really want all this technology? As my friend JP said, and very true, the patient does not want to be treated like a king, but at the same time, I have seen patients who demand the sky from the hospitals. Today, I've seen patients who demand services like a 5-star hospital, 5-star hotel, And they also complain if they don't get that. But at the end of their entire duration, when they are presented the bill, they ask, why am I charged so high? So when I bring in more technology, the cost is going to increase for the hospital. And each step of the technology enhancement has to be evaluated very carefully to see whether it is really going to make a difference to the patient. Is the patient going to appreciate it, and then think of it? Also, patients want speed. Very, very truly pointed out by all. Patients don't want to wait for OPD appointments. They don't want to wait for doctors. They don't want to wait for lab tests for half an hour, 1 hour, and then they expect results, their reports to be available to them within maybe a couple of hours at the most. But irrespective of, when you look at the other side in the hospitals, whatever be the automation, whatever be the level of digitization that we bring in, all right, there is a lot of human interaction required to put everything in place. A digitized system is not going to draw blood. A digitized system is not going to, automatically register you. Yes, there are ways to do that, but things are there where human interaction comes in, and it depends how much time, how many people want what kind of services from the hospital. So I have seen a lot of these things. I see patient satisfaction complaints every day. I see patient satisfaction experience feedback every day. And when I really sit to analyze that, the first thought comes to mind is digitization really going to help in is going to reduce this pain point of the patient? So there are a lot of things that we can do in the hospital. There is a cost also associated to that. When I talk about my hospital over here today, we have the best of automation. We have the best of digitization over here. Every process somewhere or the other is automated. Even then, is the patient really satisfied? Is the patient really not complaining? So we need to see that, and how much more is the digitization to change as we move from year to year needs to be seen. It's not like, we change the HI system, patient is happy. No, it's not going to happen like that. So we need to really put a thought to it to see each and every head of IT, CIOs, CTOs need to come together and see what exactly is it that digitization is going to help with the patient. Every hospital is doing enough, but that is not enough for the patient, and the cost is escalating for the patient. So we need to see how we can bring in digitalization without increasing further costs, which is very difficult.
So, what is the way out, Mr. Dwivedi, if I may ask you?
Challenges are really many. I can tell you, Vilu is speaking from heart. This digital transformation space is very noisy at best. Sometimes I really wonder whether this is a problem of scarcity or problem of plenty. People have plenty of solutions, but in isolated areas. And they don't care how all this is orchestrated together as a solution for the hospital or patient. So we need to do continuous triage, whom to listen to, whom not to listen to, and which solutions fit into our scheme of things. Well, so what I have done, I have applied a Maslow's need of hierarchy model and taken as a first layer is infrastructure layer. So all my servers, network, etc. are in place properly. Because if that is not there, then nothing will run. Now the second layer is ERP layer. So your procurement, your inventory management, your payroll and accounting and all those aspects are taken care of. That is very important. Then third layer comes hospital information system, HIS layer, where your patient management, your billing, your ward management, and all those aspects are taken care of. Then fourth layer, electronic health record. There you put the doctor's notes and prescriptions and lab and radiology orders and reports and everything together, building a single longitudinal patient health record. Then on top of this fourth layer comes the digital technology layer, where we talk about clinician experience, we talk about patient experience, we talk about telemedicine, clinical decision support system, all advanced technology that is sitting there at the pinnacle. So we must be very careful. Where are we standing in terms of that, hierarchy of needs? If our second layer is not correct, the ERP is not in place, third layer is not correct, every fourth or fifth bill is having some error, then forget about digital transformation. It is not going to happen. So it is very clear to actually clarify the perspective on where we stand and how we gain best out of technology available in the market and the digital workforce. Real challenges that we see, in the industry is number one, workshop to word. People talk fantastic in the workshops and webinars and seminars and gatherings, and when we really come to the ground, the reality is very different. It is very hard to use in your scheme of things. Then second is, even if you find a suitable solution landscape, you need capable people to run a IT workforce that is stable and that is delivering. Because the moment the workforce becomes talented, they would run for an IT company, not to serve a hospital. So that is another challenge, right? The third challenge comes on how expensive it is, as Bilu touched upon. Okay, it is good, but how much does it cost? And it is going to be transferred to the patient anyway. So we need to see that the technology is cost effective and the value is delivered for the buck that I'm going to spend. And then finally, there is inhibition in the technology adoption also. So there is a mindset that really needs to go through complete transformation and change. So that is what I see in terms of the challenges that are there. Of course, there are fantastic opportunities. Earlier, 5 years back or 10 years back, it was not easy to depend on a network. We had very poor bandwidth. There were problems. Now 5G is coming. Those, solid infrastructure backbone is being built up. Cloud is available. We can at least depend on the information systems and infrastructure. There is blockchain technology coming. So we can really produce a seamless experience and a continuity of care even across the hospitals. So a lot of opportunities are also there in front of us that we see. And in future, I hope we will be able to reach there, that collectively we will be able to provide all four outcomes that we are looking at.
Right, there are opportunities galore and the kind of transformation happening. I'm sure that will be. We can see a lot of changes happening in coming months and coming years, which have already seen in last 1.5 years. It has happened in India and world over, in terms of digital disruptions and leveraging those digital transformation. I'll come back to you. Let's have a perspective from Mr. Nilesh. Nilesh, your thoughts on that?
Yes, with digitization, there is a lot of data is available. Now, how to handle this data is a real question, and how much to invest to that to make that everything organized in a proper manner, and whether we can charge those whatever the added advantage what we are doing with the digital enhancement to the patient. Answer is no. Like in city like us, like where we are having our hospital, if I say to a patient that you have to pay more for that, they will say better we should do it some other location, because now the issue where we can give the some advantage to the patient, because everything cannot possible in India immediately. It will be some time will be taken for that, because if you remember that people who were talking about filmless environment earlier, the time this was discussed in somewhere in 1999, still we are struggling to really make it filmless environment. Similarly, in a hospital, if we can give like certain advantage to the patient when they are coming for the OPD, at least if you are having online appointment payment, then their feedback should be given to them. Then if there's a free delivery of their pharmacy items, if we can able to do it, so that will definitely in a small automation, but that will give some patient or patient relative some delightment. Now, when we say that for ICU OT, we are talking about this capturing data, then merging it with LIS, HIS, and PACS. Yes, there is a huge cost involved into that. For any new project, okay, they can consider at the time of procurement, but in something like with a project which is there, or hospital which is there, running for 10 years, it is not practically possible for them to invest maybe 1.5 lakhs or 2 lakhs per bed for doing all these things. So we, in that case, like what we have done in our hospital, that we have done created our own module with our own IT team, and which are able to capture the relevant data what is required for the clinician. So there is no burden on the patient also. At same time, clinician get more idea about whatever they require. Now, the one problem what we are facing is that everywhere across India is that there is no HIS vendor regulation. So whatever protocol A is using, B is having some different protocol. So patient goes with his own data in different hospital, they cannot able to access that data. This is the problem what we are facing. So I believe that there should be something should come, or some norm should come from regulatory body where this HIS vendor should be on the same platform like what we say in HL7 in medical equipments. So similarly, if we can, if something regulatory can happen, it will really helpful for everyone. Now, one more thing is that now robotic surgeries give the predictable result, and clinician also gets sufficient time so that there will be bloodless surgery can happen. But currently also the cost for that is not affordable to each and every hospital across India. So time will come that till the time it becomes affordable, it will be there in some of the hospitals, in few hospital I can say. Now there is AI algorithms are there. There are many AI algorithms are available there. But if you see that I came across one radiation oncology equipment vendor is going to give a AI algorithm on their machine. But currently, if that cost of that machine is 2 million euro, for this AI, it is going to be 4 million euro. So across world, it is 18 machines are available, but not available in India. Yes, I understand that they can give a planning system, which is artificial intelligence planning system, and which will give the physicians for their planning. They will give that this should be there, and physician maybe override that if they wants to do something else. Now they are saying that replanning can happen in 90 seconds, and which currently may be happening in maybe 15 minutes. They can do it in 90 seconds also. But the cost which is there currently, is it affordable? So answer is no. Whether patient relative or patient is ready to pay for that, for radiation oncology therapy, answer is no. Because so many patients are coming, the first question comes to their mind that whether Rajiv Gandhi scheme is there. So this is the first question what they use. So this is what the ground reality of India. We wish to have everything digital, but still there is a long time to go to make it in the real sense digital India in healthcare.
I think Piyush must be waiting to answer because till now we have the perspective from the hospital digital leaders, but Piyush representing Ognito, a company which is leveraging AI in a big way. Piyush, you have heard all of them. What will be your take on that?
Yeah, I think I'll probably, just not wear the Yognito hat for a minute, and just be, let's say, the provocative person on this call. And I have to, seek pardon from all of you, very well respected, CIOs out there. And like I said earlier, unless and until we dream, differently, we think that whatever is currently out of the realm of possibility is really possible. We're never going to get there. And therefore, if I were to really talk about, I've led several, digital transformation initiatives across the UK, US, APAC markets, in healthcare and outside. I think, in my humble experience, what I've realized is in any digital transformation project, technology and the core solution and the product is probably about 25 to 30% of the solution or the problem. The rest of it all is change management, and I end up getting into a lot of very passionate debates with a very dear friend of mine who's also from the CIO community. Now, if I were to talk about change management on one aspect, and the second part, I'll come to it, Shavik, because you mentioned the important dollar or the rupee topic in this call. When we talk about, and JP actually mentioned that very important thing, like, is this really problem of paucity or problem of plenty? There's a lot of noise in technology and disruption and AI and ML and everything happening at times that probably, just I'm sure it gives you guys a headache to say, what do I really look at and what do I really not? In my experience as operating largely from the business side, as a student of business as well, I will say, any investment that you all will make on technology should either have a corresponding and a direct impact on the top line or on the bottom line. And therefore, I think our job really in this community, in the CIO community, is really to make that entire path visible, for ourselves, and therefore, for people that will sponsor these initiatives. I'd say, for instance, that example I gave, I spent 20 minutes waiting for a doctor, during my OPD consult, right? Can I get out there, faster? If we were to, immerse a digital innovation that cuts down the doctor's amount of time that you will spend with the patient in that consult by 1 minute per appointment. Now, whether that's through, let's say imaging analytics that will, give you some, scan reports or, all of that stuff happening, whether it's an OPD or an IPD encounter, if you can reduce the amount of time that you spend on that particular episode and get more time to see more patients, right? Imagine from an OPD setup, when you're talking about revenue streams of hospitals, you're talking OPDs. As a doctor, can I do like 2 or 3 more OPDs or consults more without really that physician burnout that I normally, endure with? That's one thing that has a direct impact on revenue. When you talk about bottom line linkage, if you have a technology that enables you to do more with less, something that you can do faster, better, cheaper, I think those are the real technologies that we should go after. And the first, recipe that I would probably, leave out is to say, how do you really join the dot between technology and business? Of course, not denying the fact that, within a healthcare, healthcare ecosystem, you need to understand the workflows, the stakeholders, the patient, the physician nuances, the administration challenges, the discharge summaries that really need to be signed off by a physician, and the physician is currently caught up in surgery. And, once the physician signs off on the discharge summary, that's when the discharge goes out, all the pharmacy, gets that medication done. Then that thing goes out to your TPA, and, God forbid, as a patient, you're lucky, 30 minutes, you're out of the hospital if you are an insurance covered patient, right? Can we start expecting that to be the norm? I think that's the question that we need to ask. Do we accept that if it's going to lead to a TPA setup, 2 hours is more the average for a patient discharge? Or do we say, no, I'm not settling for that. I want that patient out of the hospital in 30 minutes because the patient we know recovers much better and much faster when they are with their loved ones at their homes, right? JP mentioned, hospital-acquired infections, HAIs. You've got a greater risk of HAIs the longer a patient stays in hospital. Once the patient is through with the surgery, the next day you're changing bedpans, you're moving on, and therefore, the sooner you can get the patient back into the comfort of their home, that's really, driving patient care. I think about half a decade ago, about 5 years ago, a lot of these innovations really started with healthcare services at home. The overall idea was, especially even in the developed markets, if let's say I'm going after, with a bypass surgery, do I really need to be in hospital for 48 hours just for a follow-up cardiologist visit to see that, my wound is healing okay, there's no bleeding, my sutures are healing fine? Or can that be enabled through feet on street where, you may not necessarily need a cardiologist, and pardon me, this is really your realm, but can we really make sure that wound is healing okay? Can we do that at the patient home? Right. I think those are a few frontiers, that we really need to push ourselves to see, when you are looking at, all kinds of hospital operational parameters like, occupancy rates and, bed churns and, turnaround times. I think those are the frontiers we really need to be conscious of and, driving towards. But then, because this is a technology setting, I'll also bring in the technology flavor to say, to really enable all of that, I think you really need to have that longitudinal record available. I think Nilesh mentioned about, there are so many, all kinds of, structured data sitting across different data structures, and, one hospital to the other, it never really talks. I think those are problems, that exist globally. There was an effort, with the FHIR data standards, where you can enable a lot of that health exchange. There's actually an interesting conversation coming up on HIEs tomorrow. when the NDHM kicks into gear, and let's say we get to that point where a national HIE is set up, not just on the public but also on the private side, I think that's where the true nature of information exchange and information flow across multiple encounter episodic settings can really be I think enabled. But long story short, I would say if you are able to do more with your investment in technology, and therefore your bottom line might still increase, but your revenue or your top line increase much greater, as long as you're improving your margins, I think that those are the cost efficiencies, Shavik, that we need to be focused on. At the same time, if there is a certain investment in technology that directly knocks off some of your operational costs, I think those are surefire wins. Those will be my comments, at least on this topic.
Taking cue from what Piyush said, as a last question to Shashank, we're almost at the end of the session. Shashank, as Piyush was saying that invest in technology, that investment can be seen as investment per se, but that's going to help you in the long run for getting rid of a lot of processes, and that's how you do automation. So, you support this, what Piyush is saying, or do you have any different take on this?
Look, first thing, right? Let's not be worried of implementing technology with a question in our mind: how do we recover it, right? Because if you are not implementing technology or welcoming it, you will be out of the game very soon. That same patient will be paying for that X amount to your nearby hospital. So I think that should not be the caution or the hindrance, in your mind. And now, for me, right, there are three ways, and I think Mr. Dwivedi also covered it in his first, points. Where we need to do in hospital automation is the question again, right? First is operational efficiency, clinical excellence, and patient experience of care, right? There are three sub areas where I believe we should keep on investing, right? And once we are able to invest and justify and show it, right, I think the question of recovery of the X cost of billion euros or $1 million or Indian rupees will be vanishing from our minds, right? There are n number of things where we can, automate, right? And with the healthcare industry continue looking to cut cost and waste and improve efficiency and throughput, right? Automation of manual tasks, right, can be an important part of a strategy for a performance improvement, like labor savings, improve quality and consistency, reduce waste, increase predictability of outcomes, higher throughput, data-driven insights, right? Piyush is focusing on a one point since beginning. Why should I wait for 20 minutes, 30 minutes, right, for a doctor to see, right? Why should I wait for an hour or 24 hours, right, to get my my lab test reports? Why should I wait, for X hours or X minutes on a pharmacy or any other things, right? I think these are the areas where if you start streamlining, with the help of technology, right? Cost will be recovered. People will have people, your patients will have their wow factor. Everything, all your touch points will be.
Dharmendra to join because I'm a little bit isolated just now.
You for everyone, right?
On this.
Healthcare has a lot of potential for cost and quality gains through automation, right? It's time when healthcare leaders start thinking about automation before adding services or renovating. Value-based care depends immensely on how healthcare organizations control the cost and care. And unlike any other organization, in any other sector, automating processes will allow healthcare organizations to focus their time and resources on their core mission, delivering excellent patient care, right? And when we are able to deliver that, I think cost, everything will be taken care of. People will not mind paying you at all. So I still say, and sorry for that I think I will not be that person who thinks cost is a problem to recover. In starting, I'll bear that cost once I have that, creating a wow factor, or that things are streamlined from my all hierarchy. As Dr. Dwivedi mentioned that from my HIS, ERP, all the gateways, I think it's fine. I think and people will start respecting you. And we being in tier 2 and tier 3 market, that's the biggest challenge for us as Ujala Cygnus. How do we shape up and give that so-called wow factor with technology in the rural part of North India, right? I believe every one of you have hospitals in the urban side, but we have a very different, geography presence, and still people love it and they do pay for it. Over to you, Shah. Ma'am, you want to say something? You were saying bye to us.
Yeah, so I wanted to say something. I just wanted to make a point that I do agree so much with what you've just said, Shashank. It's just that, yes, and it's true that if we do not bring in the technology that is required, we will not be able to survive. So it's not none of us think that, yes, everything is to be compared with the cost that the patient will have to bear. But we have to keep that in mind that when we bring in the digitization, we cannot always burden the patient to bear the cost of that digitization. Like if everyone said today, actually, if we bring in a voice-enabled system, most of what Piyush is saying will get taken care of. However, if, for example, if a TPA takes 2 to 3 hours to revert back on an authorization of a patient's limit, I think each hospital alone cannot really make a difference. The difference is made when everybody comes together under that umbrella, and that interoperability has to come in order to bring in that kind of change. Otherwise, it will not work. We are facing, every hospital must be facing the issue that a TPA patient takes almost 4 to 6 hours to get discharged. Not because the hospital does not have technology to, this, but we cannot send the patient away without ensuring that the TPS payment is also authorized. So things like that keep on becoming bottlenecks which we need to encounter, and we all need to come together in order to make that change. So there are ways where we can put up data to the TPA or more in a digitized format, which can enable a faster decision making from a TPA side and so on, so that we can really make a difference to the patient's outcomes. Outcomes not only technical, clinical, but administrative, much more.
I agree.
Can I come in with a comment? I think I think despite our best intentions and desires to resolve for that, let me also caution everybody: this is not an easy problem to solve, right? When you talk about interoperability, when you talk about HIEs, world over, people have tried, people have failed, but I think there's also a fundamental challenge as well with the way healthcare is set up in India, right? For let's say a private health system, why would I want to expose my patient data to another private health organization, right? I think patients are sources of revenue for us, and therefore with me exposing my patient's data to my competitor, that's really just losing that competitive advantage of that. So I think we need to be very conscious and cautious about how interoperability and HIEs will be set up if they do. But this is not an easy problem to solve.
So Piyush, that is the
Right,
problem
right,
nobody
right,
wants
right.
to talk about.
I think we have come to the end of this panel discussion. It was insightful and interesting. And when we talk about digital interventions, there will be glitches of digital interventions as it has happened with me. So I've logged in through the phone. So that's why you might seen that I was not there for 2-3 seconds. So that's part and parcel of using technology, and we have to live with that reality. But end of the day, if I take a crux of the discussion for last 1 hour or so, I think we all agree that we have to keep on investing in technology, or else we'll become redundant. Because end of the day, technology will help in increasing efficiency and delivering. End of the day, that will result in delivering effective patient care. Whether how to manage the cost, that can be discussed again and again, but there's no doubt that we have to keep on investing in technology innovation to uh, help in increasing the efficiency in the hospital and healthcare ecosystem. With this, I'd like to thank Vilu Williams, CIO and Head Digital Transformation, Sir H.N. Reliance Foundation Hospital Research Center, Mr. J.P. Divedi, CIO Rajiv Gandhi Cancer Hospital, Mr. Nilesh Shinde, CTO Jupiter Hospital, Mr. Piyush Arya, Chief Growth Officer Agnito, and Mr. Shashank Saini, Head of Digital Health, Ujala Signus Healthcare, for joining us in a very important session of this 3-day APAC Healthcare Innovation Conclave. The session was all about building digital infrastructure for a better and connected healthcare. This brings us to the end of the first day of this 3-day conclave. Do join us tomorrow at 10 a.m., where we are going to discuss about ensuring cybersecurity in involving digital healthcare world. Before I conclude this session, let me also take this opportunity to thank our partners, APAC HealthTech Innovation Conclave presented by Dell Technologies and Microsoft, our gold partner Ogneto, and associate partners Doxiva and Vivio, and our government supporting partners, Departments of Science and Technology, Digital India, MyGov, NIC, HSCC, Ministry of Ayush, and Government of Andhra Pradesh as well. Do join us tomorrow at 10 a.m. for the second day of HealthTech Innovation Conclave. Thank you so much for joining us. Goodbye. Take care.
Thank you.
So much.
Thank you.
Nice.
Thank you.